Hello and welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. Imagine if something as vital as your blood becomes a source of pain, fatigue and life-threatening complications. Now this is what millions living with sickle cell disease cope up with daily. A genetic disorder where red blood cells, normally round and flexible, become rigid and sickle-shaped. Now, these can block blood flow, causing pain, organ failure, and even strokes. Understanding the disease better is the first step towards compassion and awareness. Today in Wellness Watch, we discuss sickle cell disease. A life-threatening disorder, often misunderstood and tragically overlooked, continues to claim young lives across the world. Sickle cell anemia is not rare, it is relentless. A silent genetic disease, it begins its damage before a child even learns to speak. On June 19th, observed as World Sickle Day Disease Awareness Day, the spotlight turns to a global crisis demanding urgent attention. In India, where millions are at risk, the stakes are even higher. But what makes this disease so dangerous? Who is most vulnerable and what steps are being taken to fight it? Here's a report by DD India's Harshita Oberoi.
Sickle cell anemia is a genetic blood disorder that changes the very shape of life, starting with our red blood cells. Normally round and flexible, these cells become hard, sticky, and shaped like sickles or crescent moons. They clump together, block the blood flow, and starve the body of oxygen, causing pain, fatigue, and life-threatening complications. Each year, nearly 3 lakh children are born with sickle cell disease globally, most in Africa, the Middle East, and India. Shockingly, up to 70% of them don't survive beyond the age of 5 due to lack of early care. In India, the crisis hits hardest among tribal communities, who make up 8.6% of the population. That's over 67 million people. Symptoms begin as early as 6 months of age, from anemia and delayed growth to swelling in hands and feet, frequent infections, vision problem, and sudden pain crisis that can last days or send a child to the ICU. Over time, the disease leads to organ damage, strokes, blindness, joint collapse, and dangerous pregnancy outcomes. It affects not just the body, but the very rhythm of life. The cause, you ask? The genetic mutation in the hemoglobin gene. A child must inherit one sickle gene from each parent to develop the disease. If only one gene is inherited, the person becomes a carrier with no symptoms but capable of passing it on. The good news: early diagnosis is possible. A simple blood test can detect the faulty hemoglobin even in newborns. Prenatal testing, ultrasound screening for stroke risk, and genetic counseling offer families a chance to plan and protect. Treatment has come a long way. Blood transfusions, antibiotics, and hydroxyurea help reduce pain and complications. In some cases, bone marrow or stem cell transplants may offer a cure. And with breakthroughs in gene editing and stem cell therapy, science is edging closer to rewriting the future for these patients. To combat the crisis, India launched the National Mission for Elimination of Sickle Cell Anemia on July 1st in the year 2023 from Shahdol in Madhya Pradesh. The goal? Well, to eliminate the disease by 2047 through universal screening, premarital counseling, and accessible care, targeting 17 high burden states and people aged 0 to 40 years. It's a bold mission with a whole of government and whole of society approach. The sickle may be small, but its shadow is long. And unless met with timely action, it can take away childhood, dreams, and even an entire generation. The fight needs awareness, science, policy, and above all, compassion. Because no child should suffer from a disease we already know how to prevent. Harshita Obroy's report for Wellness Watch, DD India.
Alright, so sickle cell disease, also simply called sickle cell, is a group of inherited hemoglobin-related blood disorders that are inherited blood diseases which affect how oxygen is carried in the body. Hemoglobin disorders fall into two main categories: sickle cell disease and thalassaemia. And according to the WHO, approximately 5% of the world's population carries trait genes for hemoglobin disorders, mainly, as we told you, sickle cell disease and thalassemia. Over 300,000 babies with severe hemoglobin disorders are born each year. Also, the WHO has released its first ever global guideline on the management of sickle cell disease during pregnancy, addressing a critical and growing health challenge. Treatment for sickle cell disease reduces or helps manage symptoms and also increase longevity. With the right care, many people who have sickle cell disease live fulfilling lives and safely participate in most of the activities. Today in Wellness Watch, we look for these answers. What is sickle cell disease? What are the symptoms of this disease? Can sickle cells be fully treated? Can a person with sickle cells live a normal, healthy life? And what medical advancements have been made in India in this field? Sickle cell disease in India is being addressed through a combination of traditional and advanced treatments. While stem cell transplants are a curative option, they are not always accessible due to risks and donor availability. Hydroxyurea remains a key medication for symptom management, and new treatments like gene therapy are also emerging. Added to this, the National Sickle Cell Anemia Elimination Program, launched in 2023, aims to address the challenges of sickle cell disease through increased screening, treatment and research. Up on your screens, we'll have the special hospitals in the country which cater to this. All India Institute of Medical Sciences, Delhi; Safdarjung Hospital, Delhi. The Department of Hematology at Safdarjung Hospital is one of the oldest and provides diagnostic and therapeutic measures for patients with blood disorders. Also, Anna Mahatma Gandhi Memorial Hospital, Tiruchirappalli in Tamil Nadu, and Government Medical College, Nagpur, Maharashtra. To help us understand sickle cell disease better, we are joined in by guests in the studio. We're joined in by Dr. Mukul Agrawal, Associate Professor of Clinical Hematology, AIIMS, New Delhi. And we're also joined in by Dr. Ankur Jain, Assistant Professor, Department of Hematology, Safdarjung Hospital, New Delhi. Thank you both of you for joining us this afternoon on Wellness Watch. Dr. Agrawal, first, in very basic layman terms, I would want you to explain to our viewers, what is sickle cell disease?
Hello everyone. So, sickle cell disease, as has already been told, it's a type of red cell disorder. It's a genetic disorder in which the red cells have a mutation and they are not able to transfer through the blood vessels in a normal way. They become rigid, they become sickle shaped, and they block the various blood vessels and are very easy to lyse within the blood. This is how they cause various kind of symptoms in the body.
Yes, from here I will take this question forward to Dr. Jain. Dr. Jain, what is the difference between sickle cell disease and sickle cell anemia?
So, sickle cell disease is a broad term. It also encompasses various other entities like sickle cell trait and sickle cell anemia. So, sickle cell anemia is the severe form of sickle cell, but the disease, when we talk about, it's a broad term. So, it also encompasses sickle cell trait, which is an only one allele is mutated and the patients are asymptomatic. So, disease is an umbrella term or a broad term.
What are the symptoms when we talk of sickle cell disease?
So, as I said, that sickle cell can be, it consists of two alleles when they are brought together from both the parents. But one of the alleles can be a sickle, the other can be from thalassemia also. So, the spectrum can involve different type of only sickle, only trait, or a mixed combination of various sickle and thalassemias also. So, likewise the patient can have different kind of symptoms. Usually the trait or the carrier state is a asymptomatic state in which the person has some symptoms maybe at high altitude or in low oxygen concentrations, or they have some kind of exercise intolerance, but it is mostly a asymptomatic state otherwise. The sickle cell anemia, when we say that those patients who are prone to various kinds of crisis, when these sickle cells, they block the blood vessels and cause different kind of organ damage. The other problem which happens with these sickle cells, they can lyse with the blood vessels and cause hemolysis or mild anemia and jaundice. So, that is how broadly we classify symptoms of sickle cell anemia.
Dr. Jain, when does a person know? Is there a particular age group? Because in our report, we told our viewers that by the age of 5 years, a child, starts showing the symptoms of sickle cell disease. But then at the same time, sickle cell trait is asymptomatic. So put all this together, when is it the time to see a doctor? Because fatigue and, restlessness, all these are general symptoms, general problems which we face in our day-to-day lives. When is it for a patient to see a doctor? When is it the time for the patient to see a doctor?
So it is very important to understand that the manifestations of sickle cell also depends upon how severe is the sickle cell. There are various grades of severity depending upon the mutation type. So the sickle cells which are very severe, they manifest in the early childhood, like as you said, before 5 years of age. So these children can have stroke, they can manifest with the stroke also, and they can have jaundice also. So this is a severe sickle cell which can manifest in the early childhood. However, this is typically seen in the African patients.
Okay.
However, the Indian sickle is not that severe, it is a bit milder. So these patients present in the adulthood, and typical manifestation is anemia, and along with that there is a mild of jaundice. And more importantly, because anemia is very common in India, so not all the anemia patients will have sickle cell.
Yes.
So those patients of anemia who have associated jaundice or who have frequent pain, typical bone pains, because sickle also manifests with the pain crisis, as Dr. Mukul has already mentioned. So the anemia which is associated with very severe bone pains, in those patients we must evaluate the patients for sickle cell anemia.
How common is sickle cell disease and how is it diagnosed?
So sickle cell anemia or sickle cell disease, as you have mentioned, it is particularly seen in the tribal population. So in India, we have got 19 states in which the sickle is very prevalent. So if you see the National Mission for the Elimination of Sickle, which was introduced 2 years back,
Yes.
the program was directed towards those 19 states in which the sickle is prevalent, and these states are associated with the tribal population, tribal areas. So not all of the India has sickle. It is a geographical belt which
Okay.
has the sickle. For example, Madhya Pradesh, mainly the eastern and the central part of the India, that sickle population is seen in those areas. And diagnosis of sickle, as I have mentioned, that if a patient comes with anemia, jaundice, bone pains, then we suspect sickle. First and foremost, we do the hemoglobin, TLC and platelet count. We generally see that the hemoglobin is low. And then we see the peripheral smear of the patient. We see the sickle cells, typical sickle cells. The sickle shaped cells can be seen on the blood film also. But the most importantly, the hemoglobin electrophoresis. The diagnosis of sickle is established once we do the hemoglobin electrophoresis. The hemoglobin electrophoresis is routinely available in the major hospitals of the India. And once we do HB electrophoresis, we find the peak, the hemoglobin S peak is seen in the HB electrophoresis, and on the basis of the electrophoresis, we can categorize the patient, whether the patient is sickle trait or whether the patient is homozygous or sickle anemia.
All right.
Yeah.
Dr. Agrawal, what are the risks involved when we talk of sickle cell disease, and what are the organs in the body that are more prone to be damaged by sickle cell disease?
So, there are two kinds of presentation of sickle cell anemia. One is with anemia and jaundice, in which patients are slightly anemic. Usually hemoglobin can go down up to 6 or 7 gram. Sometimes these patients require blood transfusions also. The other or more common presentation is with different kind of crisis. So, the crisis in sickle cell anemia is something with which the patient present more commonly, and it is said that in the locality where the disease is more common, all kind of symptoms can be present and can be attributed to sickle cell anemia at times. So, the crisis can be of vaso-occlusive crisis, in which the sickle cell block the blood vessels and cause organ damage. The organ damage is more commonly seen in the bones, where there are small arteries which get blocked and cause severe bone pains. Then there can be damage in the retina of the eyes, there can be damage in the kidneys, there can be damage in the lung. So, one of the presentation of sickle cell anemia is with acute chest syndrome, in which the patients can present with severe onset, severe and acute onset breathlessness and cough. Occasionally they can have fever also. So, the other type of crisis is the sequestration crisis, in which these sickle cell they get accumulated in the spleen of the body or in the liver of the body. So, in such a scenario, the patients can have rapid enlargement of these organs and severe anemia to start with. Lastly, most of these patients have a very high tendency and a predilection for infections. So, some kind of infections with the different bacteria and influenza also. So, these infections can be more severe and rapidly fatal in these patients if not treated urgently.
All right. Dr. Jain, you told us that sickle cell is more prominent in a particular geographical belt of India, central and eastern India.
Yes.
Why is it so? And are sickle cells always inherited? One. And added to that, you tell us that sickle cell trait is, the patients with sickle cell trait are asymptomatic. How severe or dangerous can that be?
So as I have mentioned that the tribal population is the main population which mainly has the sickle disease or sickle gene, and because they marry within the tribes, so the gene actually accumulates in those tribes, and later on it disseminates to various areas because of the geographical migration of the population. So population migrates from, so because of the migration then it spreads. So it basically starts from the tribal population, and because of the marriage within the tribes, then the disease keeps on compounding, and then it creates a local niche for the sickle. So predominantly it starts like that, and then it, because of the geographical migration of the population, then it spreads later. And second question was that is sickle always inherited? The answer is yes, because it is a genetic disorder which originates from the mutation in the hemoglobin gene. So it is always inherited. And patients with sickle cell trait are asymptomatic usually, but when these patients are exposed to conditions, for example high altitude or dehydration, or where the oxygen levels of the body go down, for example in high altitude, then these patients can manifest clinical manifestations, especially painful crisis. So generally they are asymptomatic, but yes, under specific conditions, as I have mentioned, they can be symptomatic as well.
If either of the parents is carrying a sickle cell trait, does that mean that the child will inherit sickle cell?
So there is a 25% chance that the child will be born with sickle cell anemia. I mean anemia means both the genes are mutated. Because one allele from one parent and one allele from one parent can come together, and the child can become sickle cell anemia. That is there is a 25% chance, but there is a 50% chance that the child will have at least one abnormal allele, which is called sickle cell trait.
All right, Dr. Agarwal, what advancements have been made with regard to sickle cell disease in India and also worldwide? We've told our viewers about the National Elimination Mission for sickle cell that was started 2 years back. Added to that, what all advancements have been made in India?
So the advancements have been in the field of diagnostic as well as in the field of therapeutics. So traditionally, like Dr. Jain said, that the diagnosis of sickle cell is based on the hemoglobin electrophoresis or HPLC. So that has been the traditional test with which we diagnose sickle cell anemia. Of late, various genetic tests have also been come, which help in diagnosis of the sickle cell directly by detecting the gene which is responsible for this disease. Secondly, when we come to therapeutics, so since the late 1990s, hydroxyurea has stayed as a mainstay of therapy for sickle cell anemia. Together with it, vaccination for the patients with respect to common bugs like pneumococcal vaccines, flu vaccines. So they are always given to these patients, and supportive care in the form of folic acid and otherwise. These patients are to be cared for. The infections are to be treated early. Of late, since 2017-18, a couple of new drugs came in. One of them is L-glutamine, which is still a relevant drug, especially with respect to painful crisis, and decreases the oxidative stress in the body. There were two new drugs also which came in the market in the Western world. They were voxelotor and crizanlizumab. So these are very targeted therapies. Unfortunately, because of some reasons, both these drugs did not stood the test of time and have been withdrawn as late as last year only from the market by the companies themselves. So currently, as we speak, the medical management of sickle cell anemia rests on hydroxyurea, vaccination and folic acid. Besides this, if we think of a curative intent, so there are two kind of curative things which are there for sickle cell anemia. One is bone marrow transplantation, which is done worldwide and is available in India also. The second and the more recent thing is about gene therapy or gene editing therapies. So with respect to that, the two kinds of gene therapies are there which are approved in the US as well as in the European Union. So they are there, but slightly costly on the very, I should not say slightly, they are very costly at present. And the research on those gene therapy is also started in India as well.
All right. Dr. Jain, when we talk of sickle cell disease, then can a person with sickle cell disease live a normal life? And can sickle cells be cured completely or fully cured?
So as far as normal life is concerned, it is very important to diagnose these patients at an early age.
Early age.
If we are able to diagnose these patients at an early age and begin the appropriate treatment, for example, hydroxyurea, folic acid, Dr. Mukul has already mentioned those treatments, then the complication rates of the sickle will automatically be reduced, and which will substantially improve the quality of life of these patients and possibly prolong the overall lifespan of these patients also. However, if the diagnosis is delayed and the treatment is not started, then obviously the patients will have complications in the form of the bone crisis, in the form of avascular necrosis, strokes, and which will not only worsen the quality of life but also increase the mortality. So the key to for a normal life or a prolonged lifespan of these patients is early diagnosis
intervention.
and definitive treatment.
All right.
And as far as cure is concerned, sickle can be cured with the help of bone marrow transplant. So Dr. Mukul has mentioned about bone marrow transplant. That is the only treatment as of today which can potentially cure sickle cell completely, with the help of stem cells which can be taken from the siblings. So if we infuse normal stem cells from the siblings who are not who are the siblings who are not having sickle, so those stem cells will go and they will eliminate the abnormal cells, and then they will repopulate and create a normal population of red cells in the blood.
All right. So that means that if either of the parents has sickle cell, it is not mandatory for all the kids to have sickle cell disease?
That's what I mentioned,
Yes.
that only 50% chance is there for the children to have sickle trait. And then and even if both the parents have got one abnormal allele, there is still a chance that the child with the normal child can be born without having any abnormal gene.
Right.
So that child can be taken as a donor for the bone marrow transplant for the abnormal child.
And is it only from the siblings that the stem cell can be taken?
So best cure rates or best outcomes are with the siblings, but however, if there are no siblings are available, for example, then we can do bone marrow transplant from the parents also, because parent has one normal gene and one abnormal gene. So that parent can also give the stem cell.
All right, so very important points put forth by our doctors here, and that did clarify our doubts. Today we are discussing sickle cell anemia or sickle cell disease in Wellness Watch, and for more doubts of our viewers to be busted, for more myths of our viewers to be busted, we will have a quick rapid fire question round where I'll ask my guests to clarify with very short and crisp answers. Dr. Agarwal, sickle cell disease is contagious blood-borne disease, is it?
No, sickle cell disease is an inherited disease, it's a genetic disorder. It does not get transferred. Yes, there is a familial clustering because it is a genetic disease. It is not contagious.
All right. Dr. Jain, sickle cell only impacts people of African descent.
No,
Is it so?
even people from India do have sickle cell disease.
Sickle cell trait is a mild form of sickle cell disease. Is it so, Dr. Agarwal?
Sickle cell trait is a carrier condition. Is most of the time it is asymptomatic. In certain hypoxic condition, there can be some symptoms.
There is no cure for sickle cell disease, Dr. Jain.
Sickle cell disease has curative therapies ranging from hydroxyurea, folic acid to monoclonal antibodies to gene therapy to bone marrow transplant. So a lot of treatment options are there for sickle cell disease.
Babies born with sickle cell disease do not survive to adulthood. Is it so, Dr. Agarwal?
That's a total myth. The patients, if they are diagnosed early in life, started on hydroxyurea and folic acid, they can have a prolonged life well into their adulthood, well into their 40s and 60s, but there are some crises which do happen in between, but they can have a prolonged life.
People born with sickle cell anemia cannot bear children, Dr. Jain.
People born with sickle cell are as fertile as normal individuals. However, they need to be very cautious before marrying because they have to do the electrophoretic testing of the partner to avoid development of sickle cell anemia in the offspring.
All right, so that sums up the discussion today we had on sickle cell anemia. Thank you so much, both of you, for joining us this afternoon on Wellness Watch and helping us understand sickle cell disease. We had Dr. Mukul Agrawal, Associate Professor of Clinical Hematology, AIIMS, with us. We also had Dr. Ankur Jain, Assistant Professor, Department of Hematology, Safdarjung Hospital, and both of them helped us understand sickle cell disease better. So after this discussion, we did understand that sickle cell anemia was once seen as a life sentence of suffering, but today, from early diagnosis programs and affordable medications, patients now have more hope than ever before. The journey is long, but with commitment, compassion, and cutting-edge medicine, there is hope that even the heaviest burdens can be lightened with the power of healing and compassion. On that thought, we'll end this edition of Wellness Watch here. Till we meet next, take good care of yourselves. Bye-bye.